And welcome back, our dear viewers. And after seeing the amazing report of the Al area in Saudi Arabia, I'll tell you it's an amazing destination to all of us to visit. And of course, as everyone knows, that lung diseases are among the most serious health conditions, often starting with the mild symptoms, but over time turning into a daily struggle to breathe. One of the most concerning of these conditions is pulmonary fibrosis, a disease that damages the lungs and affects countless lives around the world. In this interview, we speak with Dr. Abdullah to learn more about the cause of the pulmonary fibrosis, the latest treatments, and of course, available for us, and how early diagnosis and healthy lifestyle choices can make all the difference to protecting our lungs. So with that, our dear viewers, please welcome with us our guest, Abdullah Alramyan. So welcome and thank you for being with us at our show.
Good morning. Thank you, everyone. Thank you for having me, and it's a great honor to be here.
You're welcome. You're welcome so much. So, Dr. Abdullah, for the first question, I want to know exactly what is exactly the pulmonary fibrosis, and how is exactly can be a danger to us?
So that's a very important question. So pulmonary fibrosis, or lung scarring, what we call, just to simplify things to our audience, lung scarring is something that builds up in the lungs, causing the lungs to not function well. So in order to understand what lung scarring means, we need to understand how the normal lung function. So the normal lung takes air, gets rid of carbon dioxide and gets oxygen in the body across the lung tissue to the bloodstream. And when lung scarring develops, that process is not happening. So patient will have difficulty inflating the lung because of a scarring, causing breathlessness or shortness of breath. And the tissue build up in the lung causes low level of oxygen, causing the patient to have low oxygen level.
That's actually really dangerous, and there's a lot of things happen to a human being after having a low oxygen level, which is like diseases, cannot function very well. So alongside that, it's really important for us to know what are the causes of this disease.
Yeah, so lung scarring has many causes, and maybe 10 to 20 causes of lung scarring. And it's very important when we see any patient with a diagnosis of lung fibrosis or lung scarring, is to go with all the causes of that disease in order to treat them, because eventually the patients want a treatment from the disease they have. So one of the most common causes of lung fibrosis in our region, especially the Gulf region, is rheumatological disease. So diseases affecting the joints or affecting the eyes, or rheumatism in our like latent language. So one of the great examples is rheumatoid arthritis or lupus. So this is one of the greatest, one of the top cause of scarring in this region. Another cause of lung scarring we see in our clinic, something we call hypersensitivity pneumonitis. So basically, just to explain that, it's a chronic inhalation of some trigger that is toxic to the lungs, and with a prolonged period of time of exposure, that will lead to inflammation and scarring of the lung. Another also cause is smoking, which will we be talking about.
Smoking
that
should be on the menu.
Absolutely. Smoking is really harmful, is very bad, and it can cause lung scarring. And one thing to mention, some patients we don't find any reason for their lung scarring, and we call this condition idiopathic pulmonary fibrosis or lung scarring. Usually affects the elderly male who had a history of smoking. But even if we don't find any reason for the scarring, we need to look to investigate for all the causes for lung scarring in our patients.
So alongside that, lung scarring is a really, let's say, an important, for these causes, it's really important for us to take care of it and to try to adhere it and address it immediately. But some of these, let's say, causes or like symptoms can be a little bit mild. You like cough, because that happens with let's say seasonal flu, like cough, like other symptoms. But which symptoms exactly we need to check up immediately when we see?
The problem with lung scarring symptoms that they are non-specific. So heart disease can cause the same symptoms for of lung scarring. So, but in general, I advise my patient to look forward a few symptoms. First of all, breathlessness, shortness of breath, feeling out of breath, not doing the activities they used to do, especially if the shortness of breath is extending beyond 2 to 3 months. Second thing, cough, so prolonged cough. I know cough is very common. Many causes can cause cough, but if the cough is not improving and it's chronic, you need to check and seek a medical advice. Fatigue is also a common symptom of lung scarring, but it's also non-specific. Many causes can cause fatigue.
Like being tired.
Being tired and like you don't want to do the usual things you want to do. So that's tiredness in general, feeling you want to sleep all the time. So it's again, it's not specific symptom, but if it's if it's there for a prolonged period of time, you need to seek a medical advice.
So as that means that it's really risky and really dangerous disease. But really important question that we need to ask to you, and I hope that you can help us with, which is that normally and generally, which age of group affecting this disease? Yeah,
that's a great question, and it depends on the cause of the lung scarring. So as I told you, the most common cause in our Gulf region is rheumatological disease. So age group between 20 to 40. But for other causes of lung scarring, for example, occupational, like for few individuals who work as a farmer, for example, they have a higher age of diagnosis. Yeah?
Because the environmental of their work.
Yeah, so it depends on the underlying cause. And as I told you, the condition called idiopathic pulmonary fibrosis usually affect the elderly individual above 50 or 60. And again, smoking also can cause lung scarring, and usually the age group above 50 years of age.
As you mentioned, smoking, and a lot of people knows that it's still one of the biggest threats that can be causing and that can be, having into anyone who are a smoker, a lot of diseases, lots of things. Can you tell us more about the silent damage that can happen to us from the smoking, and how can these symptoms appear for a smoker?
Yeah, so the problem with smoking that it can cause damages even without the patient noticing. Yeah, so it can cause problem in the lung tissue microscopically without any appearance of symptoms. So that's a big problem for the patient, because they continue to smoke, they don't know that they have any damage in their lungs, and the damage is happening and occurring with time. One of great example of this problem is a condition called emphysema, so lung destruction because of smoking, and solely because of smoking. So the lung tissue will be destroyed because of smoking, and the patient would not know about that until the disease is advanced. So smoking cessation is very important for any patient or even any individual having any problem in their lungs.
Definitely smoking is not a choice for a person to be doing, because there is absolutely no advantages. All the damages can be happening. So and always there is a way to quit smoking, and I hope that everyone who's watching and maybe practice smoking from now and then should be considering more and more that there are some like silent killers and silent damages like the lung scarring. So since we mentioned,
sorry for interrupting. What's the problem with smoking is that not all smokers will develop lung scarring or lung disease. And this is something you hear from, like, for example, in the Duania.
Yeah,
some will tell, I'm a smoker for 50 years and I don't have any disease. That is not a general rule.
You always hear this.
Yes, and we see in our clinic and in the hospital many patients with, for example, lung cancer or lung scarring or destruction of their lung because of the smoking. So they need to take care of that.
Exactly. It can happen to you, like it didn't happen to someone who's been smoking for like 50 years, but it can happen to someone who's been smoking for like 2 weeks or maybe 1 year. So it's not about that. So since we're talking about the lung scarring, and how is it really scary for us to even know more about it, what are some of the latest treatments that have been developed with technology for this disease? Yeah.
So in medicine, technology is advancing every day, every week. And in lung scarring specifically, we have already 2 medications available in Kuwait to treat our patients. We call them anti-scarring or anti-fibrotics treatment. They're there to slow down the progression of the disease or the development of scarring in the lung. And one of the latest treatment outbreak is a new medication that has been approved recently within the last few weeks. This medication is also an anti-fibrotic scarring, but what's good with this medication that it's with least side effect compared to the old anti-scarring medication. So our patient will be having less side effect with a great benefit of this medication.
But what are some of the side effects?
So So the problem with these antifibrotics we have or anti-scarring medication we have that they cause stomach upset, weight loss, and 60% of patients taking one of the antifibrotics we have, they will have some sort of diarrhea. So it really bothers them, affecting their quality of life. So hopefully with the new medication we will be having, sorting this problem.
So after having this, let's say, this cure, can it be cured and healed from the lung scarring? Or it will be like something with us, but we need to, you know, control it?
Yeah, that's a very important question, and I encounter the question that almost daily in my clinical practice. The problem with scarring that it's something permanent. It's not something that we can reverse back to normal. If it's there, it will stay there. Sometime it will progress. Majority of the time it will stay the same, so the extent will stay the same, and we have treatment to control it and to have our patient live their own independent, happy life.
Well, that's actually really good. So with early diagnostic, it can be a leader to a bigger chances to be cured from this disease.
Yeah. At least controlling the disease for now. A cure maybe not possible at the moment, but at least controlling the symptoms, controlling the scarring development, and avoiding any inflammation or ongoing damage to the lungs.
So after we finish from the healing phase, and we finish from the controlling the disease phase, to our viewers, how can lifestyle changes like exercises, nutrition, and these healthy choices that can help us to prevent this disease from happening?
Yeah, so definitely lifestyle changes are very important to implement for any patient with lung disease. So having a healthy, balanced diet, high in nutrients and protein is very essential. Exercising, as everyone knows, is very important to improve the health mechanics of how the lung behave and improve the perception of breathing in our patients. It also improves the quality of their life, improves their mood, improves many things, and like the benefits of exercise is limitless. And we advise all our patients to involve themselves in an exercise program, supervised, non-supervised, but they have to exercise
and be physically active.
Exactly, as much as they can.
Well, Dr. Abdullah, thank you so much for being with us. Alongside the many benefits of having exercise, also having a doctors such as you honoring us and helping us so much to understand more and to be more aware and sharing this amazing awareness to even our viewers. So thank you for accepting our invitation and being here with us.
Thank you very much. Thank you for having me.
You're welcome. And of course to our viewers, now we'll go to a break and then we'll be back. So stay tuned.